Welcome back. As the president and many Democrats work to repair the health care reform law, there are lawmakers on the other side of the aisle trying to repeal it. During our recent trip to Washington, D.C., CBS 58's John Coco and I sat down with Senators Ron Johnson and Tammy Baldwin, along with Congressman Paul Ryan and Gwen Moore, to get the bottom line on Obamacare. Here are those interviews straight from Capitol Hill.
If you recall, back in 2009 and 2010, when Obamacare was being deliberated, I and a number of other colleagues introduced a very comprehensive healthcare solution as an alternative to Obamacare. It had pre-existing conditions covered. It had a system where everybody got access to affordable health care, including the uninsured, without having a costly government takeover. We'll be putting out new reforms just like those old reforms that we proposed back when Obamacare was being delivered. So we have consistently said there's a much better way of solving this legitimate health care problem, an access problem, a cost problem, without this costly government takeover that is already costing us a lot of jobs. I've talked to a lot of employers in southern Wisconsin. I've talked to manufacturers. I've talked to retailers who are cutting people's hours down to 29 hours, who are laying people off, or who are just dumping people into Obamacare and not offering employer-sponsored health insurance as a result of this law. It's doing a lot of damage to the livelihoods of Wisconsinites, and it's hurting jobs in the economy. And this is why I think we really do need to repeal this law. And I've already shown specifically much better ideas, at least from my perspective, on how we can have a patient-centered healthcare system that fixes these legitimate problems in healthcare.
What I am concerned about, when you look at the differences, say, between Wisconsin and Minnesota, the premiums in Wisconsin are much higher and are anticipated to be much higher in Wisconsin than Minnesota. And it's not because of the numbers of people who have or have not enrolled in the Affordable Care Act. It's because Minnesota has been more proactive on putting the Affordable Care Act in place. You know, I'm more concerned about the dilatory and obstruction that states, governors like our governor has put in place to prevent the Affordable Care Act from working. I'm more concerned about those tactics with regard to rising premiums than I am the impact of people signing on to the program. I think eventually young people with a lot of education will eventually come to the table and enroll in this health care program. It was always anticipated that it would be harder to get young people to enroll because, first of all, they're not sick.
I'm shocked. I mean, the administration had 3.5 years. They had more than $500 million to set up a website. I was just with a bunch of internet companies earlier this morning, and they can't believe that this administration couldn't do what thousands of internet companies have done. And so what we're trying to do is we're trying to help constituents contact the insurance carriers that actually offer individual policies, at least get those quotes. It's very difficult for people to understand, you know, what kind of subsidies they may qualify for. But that's a key point. There may be some individuals that when you factor in the subsidies, the taxpayer subsidies, that might have their health care costs reduced. But the problem is, the fact of the matter is that most individuals will actually see an increase in their health care costs. And of course, that was another one of those promises President Obama brazenly made, so that if he passed this law by the end of his first term, the cost of an average family plan will go down by $2,500 per year. No, it's way up.
What is interesting when you dig deeper into those numbers is that the greatest success in enrolling in the Affordable Care Act marketplace were in states that set up state marketplaces. Now, I've been urging Governor Walker to set up a Wisconsin marketplace ever since he came into office. And it's disappointing that Wisconsin can't be enjoying the successes that those states that went in that direction are. I think a lot about the many Wisconsinites who wrote me over the years when I served in the House of Representatives, talking about having a child with a pre-existing health condition where they weren't able to find insurance at any cost. And the peace of mind that parents in that situation now have because they have insurance because of the Affordable Care Act is really so important. Think about the insurance protections that have been written into the Affordable Care Act so that you know, people can't just be dropped from coverage because they get sick.
As debate rages over the future of Obamacare, our representatives in Congress are also working to avoid another government shutdown. We'll dig into that issue coming up next on Eye to Eye. Welcome back. Remember what happened last month during the 16-day partial government shutdown? Monuments were closed, federal workers furloughed, local school trips to D.C. postponed. A bipartisan group of lawmakers is working to find some middle ground on the budget before another possible stoppage in mid-January. CBS 58's John Coco and I went to Washington to get straight answers from Wisconsin members of the House and Senate on efforts to find some middle ground on this ongoing partisan budget battle.
One of the very striking things from the hearing yesterday when we heard from the head of the Congressional Budget Office, Dr. Elmendorf, was how our policies have stunted economic growth. And we have to tackle our deficit, but we need to do so in a balanced way that, that has some reliance on significant cuts to domestic programs, but also cuts wasteful loopholes that benefit the very wealthiest corporations. I mean, all of this cannot be on the back of low-income and middle-class people, and we've got to focus on growth.
I thought the initial opening statements we had a couple weeks ago, there's pretty strong consensus that we're really tired of managing by crisis. I never want to shut down the government. I think I think the federal government does enough harm to our economy. We shouldn't pile on with these types of shutdowns. That's going to be kind of a universal feeling. So hopefully we'll come together and agree to abide by the Budget Control Act caps that President Obama signed, that 45 Democrats voted for. You'll notice the Senate budget does not abide by those spending limitations. They agree to a bill, they vote for it, and then they want to violate it right away. So if the Democrats are willing to abide by those limits, we should be able to fund the government, and we shouldn't have to even be worrying about a shutdown. Right now, I'm not 100% sure they're willing to do that.
Based on the history of all the special committees and the special committees and the super committees and the super duper committees, that this committee will be any different with regard to their ability to come up with something. I don't know if the December 13th deadline will be a barrier to their coming up with something, but what we've heard as of the current talks, that there has not been very much movement. So to the extent that people like the last minute, I guess we'd have to wait. You'd have to interview me at the last minute to see if anything comes out of it.
I've passed a budget 3 years in a row to balance the budget, to pay off the debt, to reform the tax system, to create jobs, but it's not something that Democrats support. Similarly, the Democrats are asking for a $1 trillion tax increase with a $1 trillion spending increase, and that's not something we support. So if we focus on our differences, we're just going to do this. We'll go nowhere. So what I'm trying to do now is focus on where we have common ground. We're taking a look at our budget, the Senate Democrats' budget, and the President's budget. We're comparing them and looking at where they overlap. And where is it that we can get common ground on a down payment on these problems? That, to me, means don't ask anybody to compromise their principles, but see where you can find common ground for a step in the right direction. It will not fix all of our problems. I'll be the first to say that. But it'd be nice to see us take a couple steps in the right direction. And that, to me, is constructive, and that's what I'm trying to do.
The Budget Conference Committee has a December 13th deadline to present its recommendations to prevent another government shutdown on January 15th, a date the current continuing resolution expires. Coming up next, remembering JFK 50 years after his assassination.